Good.
Hello.
Hi.
Hi, how are you?
Good.
Hello, my name is Moruph. I'm a family nurse practitioner student with United States University. Today I'm going to be performing an examination on you. I'm going to be doing your cardio and peripheral vascular examination. Is that okay?
Yes.
I also want to let you know that this video is being recorded and it's going to be posted on YouTube, so my professor can view and grade me. Do you give me a permission?
Yes.
Okay. Can you tell me what your name is, please?
Ava Garcia.
This is my patient. Her name is Ava Garcia, and also, how old are you?
12.
She's 12 years old. What's your date of birth?
8/3/10.
Okay, thank you very much. So she told me date of birth and her name. So I'm going to go ahead and start the assessment. The first thing I'm going to do is to check her blood pressure on both arms, and I'm going to check her blood pressure while she's sitting upright, and also while she's laying down. So I'm going to check those blood pressure and I will compare it. Next, I'm going to check, I'm going to assess his jugular venous pressure. I'm going to measure the size of our internal pulsation from the sternal notch to where the pulse is located, the internal one. So let's go ahead and do that, okay? So can you face that side for me, please? And with this, I'm looking for external jugular pressure, which I can see right here. And the next thing that I will do is to find an internal vein, jugular vein, all right? The external jugular pressure is right there. I can see. And by the way, the head of the bed is going to be like on 35% degree, 30 to 35% degree, or 40 degree. But I will do for this for the purpose of this video, I'm going to do 35 degree. All right. So like I said, I saw jugular venous pressure vein right here. That's the external one. External jugular vein is right there. So now I'm looking for an internal jugular vein and the pulsation. Okay. Okay, right there. So this is the pulsation right there. So and I'm going to mark it where the pulsation is. Right there. So the next thing I'm going to do is to measure where the pulsation is from the this is from the sternal notch right there to the pulse, and it's 1.5 centimeter. Okay, let me try to do it on that side so the camera can see. It's right there, 1.5 centimeter. Okay. So I just check my patient. I'm just checking the size or the distance of the pulsation from the sternal notch to where the pulse is, and it's 1.5 centimeter. The next thing I'm going to do is I'm going to palpate our carotid arteries one at a time. Okay. Can you put your hand down for me? So I'm going to palpate your carotid artery. I didn't feel it yet. So with carotid artery, I'm looking to feel amplitude, upstroke, and trill. Upstrokes is usually like brisk and smooth and brisk. Okay, right there, I can feel the carotid artery right here. I can feel the carotid artery right here. Again, I'm feeling for amplitude, upstroke, and trill. Upstrokes usually happen like after S1, before S2. And upstrokes is usually smooth and brisk, right there. Can you get on this side for me as well? No, right there. Just face here. Look over here so I can see this part of the neck. A little down. Very good. So I'm feeling for a carotid artery again. Okay. Again, I'm palpating for amplitude, upstroke, and trill. Upstroke usually happen after S1 and before S2, and upstroke is usually nice and brisk and smooth. Already, very good. So the next thing I'm going to do is I'm going to auscultate your carotid arteries. Okay, I'm going to listen. Look over there for me, please. Okay, I'm going to auscultate with both diaphragm and the bell of the stethoscope. So I'm listening now. I'm listening to breaths here to see if there's a breath here. No breaths. And I'm going to do the same thing for the diaphragm, the bell of the stethoscope. I can hear S1, S2, no breaths. Face here for me. Again with the diaphragm of the stethoscope. I can hear S1, S2, no breaths. And I'm going to use the bell of the stethoscope now. Okay, I can hear S1, S2, no breaths, no breaths. Okay, very good. The next thing I'm going to do is to do an inspection of our chest, and I can actually do it from here too. So I'm going to do inspection of our chest. With here, I'm looking for any abnormalities. One of the things that I'm going to assess here is a sternum, all right? And I'm looking for any abnormalities, like any abnormal pulsation. So I'm going to be looking. I didn't see any abnormalities on her chest, and I'm looking for like a ventricular, precordial, and apical impulse pulsations. I didn't see any of those. The next thing I'm going to do, I'm going to palpate auscultation area like the aortic, pulmonic, tricuspid, and mitral valve. I'm going to palpate all those areas. Okay, so that's the next thing I'm going to do. So let me come to that side. So I'm going to start the palpation, and I'm going to start from aortic area, which is on the right sternal border, second intercostal space right there. So I'm going to palpate that, which is that's the aortic. All right, I'm palpating that. Okay, and the next thing I'm going to do is pulmonic, and it's on the left second intercostal space. It's right here on the left side. I'm going to palpate that. She's a female, so I'm not going to try to press too hard. But if this is my female patient, like a real patient, I'm going to definitely palpate all the areas so to complete my assessment. But for demonstration video, I will just assume that I'm palpating this side. So the pulmonic area is on the left second intercostal space, and I'm going to move to F point, which is on the left third intercostal space. After F point, I'm moving to the tricuspid. It's on the left lower sternal border, fourth intercostal space. And I'm going to move to mitral area, which is the mitral is the apex of the heart. It's also called PMI. It's on the left lower sternal border, fifth intercostal space, mid clavicular line. All right, and that's the apex of the heart. So I did all those palpation, and I'm going to come to that side now. So with all those palpation, I'm feeling for trails, I'm feeling for lifts, and I'm feeling for lift in all those areas, APTM. So I'm feeling for trails, lifts, and lift in all those areas. I'm also going to palpate the abdominal aorta, all right? So it's right there. The abdominal is right above the umbilicus. So it's right there. I'm going to palpate that, trying to feel for breaths, which can be like a sign of blockage. I didn't see any bruise. Okay, I didn't see any bruise. Okay, so I'm also going to do iliac arteries. I'm going to palpate the iliac arteries too, and right there, and on both sides, I'm palpating that too, on both sides, feeling for bruise. And I'm also going to do a femoral arteries. Okay, right there. Femoral is down a little in the groin area, but renal artery is right here. I'm going to do the renal arteries right there, palpate it. It's right here on both sides, okay? And femoral is in the groin area. So I'm going to do all those aorta, arteries, renal arteries, and renal arteries, iliac arteries, and femoral arteries. So I'm going to do all those. The next thing I'm going to do is I'm going to auscultate our heart, okay? Again, I'm going to do all those aortic, pulmonic, tricuspid, no, aortic, pulmonic, EPS, tricuspid, and mitral valve. So I'm going to do all those now. I'm going to auscultate them. Let me come to that side. So I'm going to start from here. That's the aortic. It's on the right second intercostal space. And pulmonic is on the left second intercostal space. And F point is on the left third intercostal space. And also I'm doing tricuspid. It's on the left lower sternal border, fourth intercostal space. And lastly is the PMI. That's the apex of the heart. It's on the fifth left intercostal space, mid clavicular line. And this is the apex of the heart. And here I'm going to also, as I listen, I'm going to be listening to normal S1, S2, or abnormal S1, S2, or abnormal long sound like S3, no, like extra long sound like S3, or abnormal, I'm going to be listening to extra heart sound like S3, and abnormal heart sound like murmur. I'm also going to be looking for listening to S1, S2, which is the normal heart sound. Again, abnormal heart sound like murmur. And I'm also going to be looking for splitting S2. So splitting S2 happens if I have asked the patient to take a deep breath. Can you take a deep breath for me? Very good. And splitting S2 can happen here. It can be normal or abnormal. So splitting S2 is whenever a patient takes a deep inspiration, and pulmonic and the aortic valve, they kind of presented themselves separately, like S2 presented themselves separately. And this is due to pressure of the lung from inspiration. So that's what splitting S2 is, meaning that S2 split, and they presented themselves separately. Okay, sometimes with inspiration we can hear splitting S2. Okay. So I just listened to her heart sound, and I didn't hear any murmur. I didn't hear any abnormal heart sound. I only hear S1, S2. So with that auscultation, I'm also going to use the bell of the diaphragm as well. We're going to use the bell of the diaphragm. No, the bell of the stethoscope, sorry. I'm using the bell and diaphragm of the stethoscope. So I'm going to use the bell of the stethoscope now to listen to those areas. So this is aortic, it's on the left second intercostal space. And this is pulmonic, it's on the aortic is on the right second intercostal space. And pulmonic is on the left second intercostal space. And we move to F point. F point is on the left third intercostal space, and tricuspid is on the fourth left intercostal space, and the last one is on the apex of the heart is on the left fifth intercostal space, mid clavicular line. All right. So those are the area again. With the bell of the stethoscope, I'm looking for S1, S2, which is the normal sound of the heart, and I'm looking for any extra sound like S3, S4, and I'm also looking for abnormal sound like murmur. And at the same time, I'm also going to listen to splitting S2, which is whenever I have the patient to take a deep breath, if I hear a splitting S2, it's going to be that the pulmonic and the aortic valve, they are closing separately due to the pressure of the lungs from inspiration. All right, take a deep breath for me. Take a deep breath. Okay, take a deep breath. Okay. So the next thing, I didn't hear any splitting S2 here. So I'm going to observe a peripheral. I'm going to do a peripheral exam. I'm going to start from the chest. So let me come on that side. So normally for my patient, I'm going to have the patient to take off their shirt so I can assess on their chest. So what I'm looking for here is that the other thing that I think I forget to do is to listen to the aortic aorta with my stethoscope, with bell and diaphragm of the stethoscope. So I'm going to listen to the aortic. I'm feeling for any. I'm listening to try to see if there's any bruise. So right now I'm going to listen to the aorta. Okay. For any bruits, and I'm going to use the bell of the stethoscope. Just above the umbilical. Then I'm going to do renal. Listen to renal on both sides. No bruise. And iliac on both sides. Iliac arteries on both sides. No bruise. And I'm going to listen to a femoral on the groin area. Listen for any bruise. No bruise. And on this side too, listen to any bruise. No bruise. So now I can move to the peripheral examination. So what I'm going to do here, I'm going to split the body into four. So we have bilateral upper extremities and we have bilateral lower extremities. So with this, the first thing I'm going to do inspection. So I'm going to inspect upper and lower extremities. I'm looking for any edema, any shunts, any varicose vein, or any abnormalities. I'm looking for the color too of the skin, and I'm going to feel the temperature of the body too. I'm feeling the temperature of your body to see if you are hot. All right, very good. Okay, so the skin is nice and warm. The temperature is normal. I didn't see any edema. I didn't see any shunts. I didn't see any varicose vein. Everything really looks so normal, according to my inspection. So the next thing that I'm going to do now is I'm going to check on our pulses. Okay, and I'm going to come on that side so I can be able to get a hold of the legs when I get to the legs. So right now I'm checking for a brachial arteries right here. Brachial arteries right here. I'm going to check a brachial arteries. I'm going to grade it too, so I can feel it is nice and strong. So I'm going to grade this 3+. All right. I'm going to check her radial pulse, and it's nice and strong. I'm going to grade it 3+. Okay. The next thing I'm going to do is to check a femoral. Again, it's on the groin. It's nice and strong. I'm going to grade it 3+. The next thing I'm going to do is on popliteal. It's right there behind the knee. Okay. I can feel the pulse there. I'm going to grade it 3+ too. Okay. And the next one that I'm going to do, make sure your leg can see the camera right there. Okay. Okay. No. Yeah. No. Do this. Can you move this hand away so we can see? Okay. Right there. So what I'm doing now is on top of her leg towards the back, and it's dorsally pedal. It's pulse, and I'm feeling that too. I'm feeling that. Okay. It's 3+. I would say this is 3+. And the last one I'm going to do is posterior tibia. Okay. Posterior tibia is right here. Okay, I can feel that too. My left hand right there, posterior tibia is right there. I can feel that too. It's 3+. So during my inspection, I just remember that I did not check the fingernail for check for clubbing, and also the capillary refill. So I'm going to do that, and the toes too. Okay, pick up your leg for me. So I'm checking your toes, your toenails for your capillary refill. Okay, and it's less than 1-2 seconds. And this too, I'm going to check all the 5 toenails, less than 1 second. Less than 1 second. Less than 1 second. And this one too, let the camera see. Okay, very good. Less than 1 second. And I'm also checking the toenail for clubbing as well, and the color. All right. I didn't see any. The capillary refill is less than 1 second, 2 seconds, and also there's no clubbing. So I'm going to come to the upper extremities now. Okay. Right there. So a toenail, I'm checking this for capillary refill right there, less than 2 seconds. Again, with all this, I'm also looking for the color of the skin to check for cyanosis or any stainings, any hemorrhage or shunt. I'm also checking for all this. I didn't see any of those. Can I see this? So I'm looking for clubbing as well here. Okay, I didn't see any clubbing. I didn't see any clubbing, and I didn't see any cyanosis, and the capillary refill is less than 2 seconds. Can I see? Very good. Lastly, the next thing I'm going to do is I'm not really sure if I listen to the F point with my auscultation. I just want to be able to touch that, all right? Right quick. So the F point is on the left third intercostal space, right there. That's the F point. And I'm going to listen with my diaphragm and my bell. That's the F point. Okay. I believe, let me come on that side. So I believe this conclude my cardio-peripheral examination. I forgot about the capillary refill and the clubbing to check for cyanosis, hemorrhage, staining. I check all those on both upper and lower extremities, and I listen to F point. So this is going to conclude our examination today. Do you have any question?
No.
Okay, thank you very much, and I will see you next time at the clinic. Thank you.